Hello Ashton, nice to see you again.
Hi.
So it's treatment day today.
Yes, very exciting.
And if I can just recap.
Okay.
First of all, has there been any changes in your medicines or health since we last met?
No.
Nothing at all. Good. And we're going to do your cheeks.
Yeah.
We agreed that you wanted fuller cheeks.
Yeah.
And that we're going to do your lips.
Yeah.
Mainly your upper lip.
Yeah.
But we'll do also some in the lower lip to balance.
Okay. Yeah.
All right. And I'm going to go through now the risks and complications associated with the treatment.
Okay.
I'll put numbing cream on first. And while that's working, we'll go through this. So commonly, you can expect some pain or discomfort with the needles. You've had dermal filler?
I've had it before, yes.
Okay.
Yeah, and I didn't really experience any pain or discomfort.
Right, so you shouldn't do with this one then.
Yeah.
The filler does have some anaesthetic in it as well, so I don't want it to be an uncomfortable or painful treatment for you. After the treatment, there might be a little bit of swelling or redness.
Right, well, how much swelling? Because I don't really want anybody to sort of look at me and think, oh, she's had her lips done.
When you had treatment before, was the swelling, did you notice swelling then?
No, I didn't notice any swelling, and I wasn't told that there could be any swelling, so I wasn't, expecting anything. And I think maybe a little bit red, but not necessarily a great deal of swelling. But
I remember you saying you weren't happy with that treatment result because it only lasted a couple of weeks. I suspect that the result you had initially involved some swelling, and after a couple of weeks the swelling had settled and you noticed the difference between the two. So that may be the case this time as well.
Right, okay.
I don't expect the swelling to be disfiguring. I can't guarantee that it won't bother you, but I don't expect it to be disfiguring.
So do you think when I go home my husband will be like, oh, you've had your lips done?
I would be prepared for that because the lips in particular, more so than the cheeks, they do swell. There's going to be definitely some swelling, and some people experience it more that evening and more the next morning.
Okay.
And it can be 50%, more than the result. So it can be quite marked in the lips. It does settle very quickly.
Right. I was never told this before.
Did you haven't had your lips done before, have you? Only your cheeks?
Only the cheeks, yeah.
The lips will swell.
Okay.
But they will settle quickly. So your partner, I would say if you're worried that your partner will notice, then you think again about having it done, and have it done when he's not around, because he may well notice.
Okay.
Tell him that you've had some allergic reaction to something, or some lipstick has not agreed with you.
Right, okay.
If you need an excuse. I always think it's better to just tell them that you've had something done. Yeah. So those are uncommon, and it's possible to get bruising. You're using a needle.
Right. Again, this has never been explained to me before.
But you've had treatment before, and they didn't tell you to expect bruising.
No.
No. Well, it's possible that you can get bruising because we're using a needle, and a needle can damage a blood vessel.
But how likely is? I mean, I don't bruise very easily, so really,
Well, you're young and you're healthy, so if you do bruise, it's likely that it will clear up quickly. But I can't guarantee that you won't have bruising, and I can't really predict your chances of getting bruising. It's just that using a needle, we can cause a bruise.
So do you think, though, I didn't have bruises last time, so is it just as likely that I wouldn't get them again?
Every time you have an injectable treatment, the risk of bruising is the same.
Right.
And it doesn't matter whether if you had bruising before, doesn't mean you'll get bruising this time. And conversely, if you didn't bruise before, doesn't mean you won't bruise this time.
Okay.
So if you do get a bruise, is that something you're going to be able to cope with?
Well, I wasn't expecting to be able to be having a bruise because I didn't have one the last time. So, I'm not keen on the thought of having a bruise and the swelling, because I feel like I'm going to look like I've had a lot of stuff done. So.
Well, it's an option. It's easy to create a story around a bruise. But if we were very unlucky and we're doing 2 different areas, it's less easy perhaps to explain a bruise on your cheek and a bruise on your lip.
Yeah.
It is an option for us to separate the 2 treatments and do one area today, perhaps do your lips today and your cheeks another time.
Yeah.
If you want to do that. And if you get a bruise, plan a story in advance, as long as you can trip off a not overly exciting story.
Yeah.
To explain your bruise, people will be entertained briefly and then forget about it and won't worry about it.
Okay.
Okay. And then we've got some more serious, possibly more serious side effects, but they are much, much rarer. One in a football crowd for these. It's possible to get an infection.
Oh.
It's possible to get some inflammation, some redness and swelling.
Right.
It's possible to get skin discoloration, which can take a while to fade if you get it.
Okay, so what sort of discoloration do you
I think, I've never actually seen this, but I think it's pigmentation left from a bruise that has taken a long time to go.
Right.
And some fillers, when they're injected in certain areas, can reflect the light a little bit differently. That's not going to be the case for the treatments we're doing for you.
Okay.
But if you were to get a big bruise, then it's possible to get pigmentation.
Right.
Not likely, one in a football crowd, but it is possible.
Okay.
Infection or skin discoloration may occur within a few days or may appear weeks or months later. And it's possible to have an allergic reaction to these fillers, very rare, but possible.
Okay.
And that might present as redness or swelling or itching in the area that we've treated, or in very, very rare cases, severe allergic reaction with collapse and admission to hospital.
Oh, right. This is a complete shock. I've never had this explained to me before.
Really?
Really, yeah, I didn't realise it.
Well, it's our because this is a treatment you're choosing to have, not one that you need to have. And even in treatments that you need to have, if you go to hospital, the doctors will explain all of the risks and complications involved with higher risk procedures, and there are risks associated with this, and because it's a cosmetic treatment you're choosing to have, you don't have to have it. We really do have to inform you about all the risks so that you can weigh them up and decide to go ahead when you're happy, or if you're happy, that the benefits outweigh the risks for you.
Yeah.
So you need to take on board all of these risks and be prepared to take them in order to have the treatment.
Okay.
What I can tell you is it's my job to manage the risks and to make sure you have a safe treatment. So I need to be using the right products for you, safe, well-established products.
So are any of these side effects more likely dependent on which product you might use?
Well, we must avoid using the wrong product in the wrong place. So the products I'm using are all FDA approved. They're well established. They've got a very wide experience and data of safety and efficacy, and I'm using them in a way that they've been designed to be used.
Okay.
I've been well trained, I'm experienced, and I'm not going to take any unnecessary risks.
And you've never seen any of these more serious side effects before?
I haven't had direct experience of them, but I am very aware that even in experienced hands, any of these things can occur.
Right.
So I'm not in a position to guarantee you that they won't occur.
Okay.
All I can promise you is that I'm properly qualified, I'm properly experienced, I'm choosing safe products, and I'm going to use them in a safe way. And I'm going to, if you're very unfortunate and do suffer any unwanted or undesirable side effects or complications, I'm going to look after you. So that's what I can promise you.
Okay.
And in all my 18 years and thousands of treatments, I haven't had anybody suffer. They are rare.
Okay.
One in a football crowd.
Yeah, okay.
Okay. If you have a problem, you must tell us about it, come back, and we manage it.
Okay.
So I'm going to carry on down the list because I haven't got to the end of it.
Right, okay.
Sorry. Abscess formation, which is a kind of infection. Prolonged swelling, which may occur early or be delayed.
Oh, so swelling
later on.
could come a couple of weeks down the line?
Rarely.
Right.
Rarely. Persistent lumps, nodules or papules. So those are really describing the size of lumps.
Yeah.
It is possible, particularly in the lips, that you'll be able to feel the filler, and it may not feel smooth.
Right.
Because sometimes we don't inject it smoothly. We want to get the correction that we want. So you might feel the filler,
Yeah.
but I don't want you to be able to see lumps or bumps.
Yeah, I'm very conscious that I don't want, you know, any sort of visible lumps or bumps.
No, I don't want that either. So I'm going to advise you after the treatment, if you do feel any lumps and bumps, you can feel free to massage them. That helps them settle.
Right. And if you do get them, can you get rid of those lumps and bumps?
It's possible, yes. If they're disfiguring and they're bothering you, then we can look at dissolving the filler.
Right. Okay.
The kind of filler we're using, we can dissolve.
Okay.
Then we have acne-like formations, which again is related to probably to infection. Very rarely, if I were to inadvertently, because I'm not going to do this intentionally, inject the filler into a blood vessel, it can block the blood vessel, stopping the circulation to the skin that's serving. And that's not unlike frostbite. It's going to damage the skin, probably.
Again, this is something, you know, I'd never even considered.
Well, it's my responsibility to make sure you're making an informed decision and that you're aware of the risks. Now, I'm going to do everything I can to avoid that problem. And so far in my career, I've been successful in avoiding that problem.
Right.
Heaven forbid it happened. I know what to do to manage it, and I would take every step to recover the circulation before there's any damage to your skin.
Right.
And again, manage that complication if it arose.
So worst case scenario, say you couldn't stop the, you know, the tissue being damaged, what would be the outcome?
Well, again, I can't predict, but what I would expect is that we'd manage your skin through a good, healthy healing process.
Right.
And you would be, you know, managing a wound for a period of some weeks, but we would achieve healing and hopefully no scarring. Because the face does heal very well.
Yeah.
But we just have to hopefully not cross that bridge, but if we had that bridge to cross, we would cross it together, we'd look after you, and we'd aim for a good outcome and no long-term harm for you.
Okay.
But that's all I can promise, that we would work towards that.
Okay.
Hopefully we won't have that problem. And then this one is a very, very rare complication, 1 in 50 million.
Right.
And I have to say, in the areas we're treating, these aren't high-risk areas for this particular problem, but I have to inform you about it. There have been some cases of transient, that means temporary passing, visual disturbance or permanent blindness following dermal filler or fat injections into the face.
Oh, right.
So I wouldn't be doing my job playing Russian roulette with somebody's sight.
Of course.
I'm respectful of that risk, and I don't want it to happen, so I'm very cautious in areas where there's a significant risk of that happening. It's not really a risk for the lip treatment.
Okay, and what about the cheeks? There's no risk, okay.
Okay, most people's faces, including your own, are not perfectly symmetrical, and that works. That's a normal face. So I'm going to say that with this treatment, I'm not going to be aiming to achieve perfect symmetry. It's usually not achievable.
Right.
But what I'm not saying I'm going to make you look symmetrical. I'm not Picasso, so I'm not going to make you look asymmetrical. Rather, I'm going to work with the features that you have and enhance them a little bit.
Okay.
Okay. Correction is expected to last for a period of 6 to 12 months.
Okay.
and it can be longer, and in rare cases it can be shorter. So we just have to see. You've had fillers before,
Yeah.
and your perception was that they didn't last long. They didn't last very long.
Couple of months. Yeah.
So that's unusual. Sometimes it's that you have some swelling to begin with, and once that settles down you feel that the filler has gone. I can't guarantee or control how long the filler lasts. I can only say I'm using good quality fillers that are designed and tested, and generally in the general population they last an average of 12 to 18 months.
Okay.
If it's shorter for you, or if you feel after a few months that you want more correction, that means adding more filler, which will be charged. You know, you will have to pay more for.
Right.
So you've been very clear that you don't want to look different. You don't want people to think you've had anything done.
Yes, but at the same time, I think, you know, I do want to notice the difference myself. I do want to have the, you know, the sort of concerns about my top lip not being as full as my bottom lip addressed. So I want to notice a difference myself, but I don't necessarily want anybody else to notice a difference, if that makes sense.
That makes sense. I think it's a difficult goal to give me, isn't it? That you want to be able to notice it yourself, but nobody else to be able to notice it, and it's a perception thing. So I'm going to do a treatment that I think will give you a result, but not such a result that other people will think you've had something done.
Right.
I can't control how perceptive people are. So what I would suggest is that we do a cautious treatment and add to it later when we've established whether it's the right amount, not enough, or too much.
Because I definitely want a bigger lips, but I do not want to look, you know, the ducky sort of expression. I don't want the sort of, you know, trout pout lips.
Okay, so then I will you'll have the mirror during the treatment, and I'll do a little bit and we'll add to it.
Okay.
Be aware that there will be swelling, so whatever you think of the results today, it might settle down and you might lose some correction, but it's better to add to it than to do too much and then you be uncomfortable with that. Does that sound reasonable?
That makes sense, yeah.
Okay. And then alternative treatments, we really didn't discuss any alternative treatments, and I do think that dermal fillers fits your budget, fits your expectations. It's got a good safety profile, good instant results, so I just think it's
the right
treatment for you. I'm not guaranteeing the results. We've discussed the probable result. I think I understand what you want.
Yeah.
You think you understand what I'm aiming for.
Yeah.
What I can't promise your satisfaction with the result.
Right.
I can promise you that I'm going to give you a safe treatment.
Okay.
And I'm not going to make you look stupid.
That's important.
All right.
Yeah.
I can comfortably promise that.
Okay.
But how you feel about the result, I can't promise.
Right.
You understand if you suffer any adverse reactions, you do understand it's really important for you to come straight back to us for us to look after you and sort them out. And that includes just not being happy with the result. We want to talk to you. We want to see you and talk to you about that. I can't manage a problem over the telephone, so it will require you coming back.
Okay.
And you must feel free to come back at any point if you feel any problem you've got is related to the treatment that I've done.
Okay.
You agree to follow the aftercare advice.
Yes.
And information about you is going to be maintained confidentially. I'm going to take before and after photographs as part of your medical record.
Yeah.
At consultation, you asked to see pictures of treatments. Would you mind if I shared your before and after photographs with other patients in consultation?
Would my full face be shown, or would it just
Not necessarily. We can anonymise like you saw with the other images.
Yeah, as long as my identity wasn't obvious, I wouldn't have a problem with that.
All right. So when you look at signing this form, I just want you to look at those boxes, tick an initial. If it's a yes or a no, it doesn't matter to us.
Okay.
And of course, you can change your mind at any point point, just let us know if you want to change your mind. So I'll get you to
Thank you.
have a quick look through. I have read it to you, and when you're happy, sign and date.
Okay.
Are you happy that you've been given enough information and you've had time to process it?
Yes, I feel like you know, I've had the treatment before with the cheek fillers, but I wasn't aware of, you know, any of these sort of side effects really. I mean, like I said, I didn't bruise before, so I wasn't anticipating a potential bruise or much swelling. And the other more serious ones, whilst, you know, you've said is unlikely, you know, I'm still quite concerned about some of those things. Would
you like to take some time to think about it and perhaps not have treatment today until you're happy with?
Yeah, I think so. Just
decision.
Because, you know, I wasn't expecting any of these things, and the bruising and the swelling could be a bit of an issue. I've got a couple of social events planned, so I don't want to sort of draw attention to myself unnecessarily. So maybe some time and reschedule.
That's absolutely fine. The information sheet that I gave you at consultation did talk about the bruising and the swelling regarding scheduling.
Right.
So do make sure you read that again.
Read it properly.
And you can take this form with you as well to digest, and if you want to discuss with your partner, you can.
Okay.
And then just make another appointment when you're happy to go ahead.
Okay.
All right.
Thanks.
All right. Thank you.